want no more IV. They will take tablets if they have to take tablets, but they don't want any more sticking. Some people say, listen, they don't want anything at all. They don't even want to go back in the hospital. But some people may say, yeah, take me back to the hospital. I don't, I want to do the full works. But it's important to have that discussion with them. And another important thing is to ask your patient, ask your relative, who is in charge of making decisions for you? Should you not be able to make decisions for yourself? Because, and I'll come back to the example of having multiple children, multiple siblings, that is often a time where you start to see conflict developing. But if it is that you were to set those guidelines very clearly from the start, everybody could get behind that and work as a cohesive unit. So these are some of the important questions to ask ourselves and to ask the person in mind. What does end of life itself look like? Now, this could vary from patient to patient. So these are not specific. But sometimes when we think about diagnosis of cancer, you see weight loss, a decrease in energy levels. Sometimes people experience pain. With patients with heart failure, they may have shortness of breath or swelling of limbs because of fluid accumulation. With patients with kidney failure, they may have vomiting, diarrhea, confusion, disorientation. And this is not standard for all patients. The reason I just touched on some of those symptoms is that as palliative doctors, we know what to expect, and we are here to guide and to provide how much support we could and be able to manage these symptoms as best as possible. Now, we spoke about palliative care and we spoke about hospice care or end of life care being an aspect of palliative care. So, what exactly is the hospice aspect? And the hospice aspect is what most people are familiar with. It has a focus purely on comfort and quality of life. It involves treating symptoms that might be distressing to patients. We aim to treat patients, not numerical values or numbers. So when we take a hospice approach to care, you would realize that certain things, certain blood tests is not the focus of our priority. Certain vital signs are not the focus of our priority. Our priority is making sure that patients are as comfortable as possible. And as doctors, we find ourselves asking, what will be the benefit of this treatment at this particular stage? Because we have to always weigh that against the risks and the side effects associated with it. So for an example, at the end stages, am I going to try to control your sugars very tightly, where it runs the risk of your sugars dropping very low and you're becoming very confused and disoriented? Or it runs the risk of you becoming very nauseous or having diarrhea as a side effect of the medication? Whereas at the end stages, your sugars could be in the 200s and it would not have any impact on your health at all. So it's very easy sometimes to read a textbook or to look and see what are baseline sugars. But as a palliative approach, we want to take a holistic look at it and ask ourselves, what are the benefits of this versus is this going to cause more side effects or more damage? Now, in the local context to Trinidad and Tobago, important things to note. When we talk about palliative care and hospice care, there always comes up the topic of euthanasia. And now there's the term assisted suicide. And I've had patients ask me about these things because when they are dealing with chronic conditions, some of them start wondering if this is an option. In Trinidad and Tobago, it is not legal for euthanasia or assisted suicide. So that is not an option by any means anywhere here locally. What some patients do though, they have the right to refuse escalation of care. And that's what I touched on earlier in terms of not going to hospital, not doing any aggressive IV antibiotics. That is within their right in the local context. And that is because they have their right, their autonomy to make decisions for themselves. But a doctor can't come and do euthanasia or give medications that will facilitate a patient's passing. And then important things to note as well too in a local setting. I mean, if we do have a patient or we do have somebody who is a palliative, what are the resources that we have available for us? In the public sector, which falls under North Central Regional Health Authority, we have the Cora facility, and then most recently under the Southwest Regional Health Authority, we now have the South Cancer Center, which was previously the Augustus Long Hospital, that does have a palliative unit available. In the public-private sector, there's also the Living Waters Hospice, which is based in Port of Spain, as well as the Vitas House Hospice, which is based on the St. James Medical Compound in Port of Spain as well too, which also has palliative units available for patients. And other aspects that we always just need to be conscious about, but we can't get into detail of it now, is caregiver burnout. Caring for patients can be very draining physically, emotionally, mentally. And it's important sometimes to take a break and focus on ourselves. It does not make you any less caring, but you have to be able to preserve yourself for the long run. Whether it is that you do shifts with other family members, whether it is you get a caregiving service on board, any of these things, but it's important to preserve yourself. Quite often as spouses and as children, we want to be able to be the ones there, but you have to preserve yourself for the long run to continue to allow that. And as I mentioned, palliative care does not just stop at the end if a patient passes. Grief and bereavement and support groups is an important aspect of it. So don't hesitate to reach out to your doctor and ask about this because it's important and it goes a long way in helping you deal with the process. So that was just a very brief overview of some of the topics surrounding palliative care, some of the misconceptions. If anyone has any questions, you can feel free to ask.
So thanks, Doc. We have some time for questions, and there's a cordless mic. So we have one question from Mr. Suku.
Sitaram to you, Doc. Your lecture this morning is indeed an eye-opener because our concept of palliative care is confined to caring for kidney patients, cancer patients. I'm glad you gave us this comprehensive and wide-ranging overview of what palliative care is. I'm glad that you made a reference that the caregiver, after the passing on of the patient, the caregiver there is left to grieve without any avenues of how to grieve. And I think this is one of the things that we need to touch on. I term it the agony of grief because it leaves a terrible psychological impact on the caregiver after the person has passed on. From your expertise there, your end of it, is there special counseling available for the caregiver after the patient has passed on? In other words, how to grieve? How do I come to terms with this passing? Thank you.
So there is that available through therapy, through counseling. We recently started group sessions. It's based in Port of Spain, but we are trying to get it online as well too because we've seen this need and we've seen the benefit in group sessions where people could relate to each other and support each other with these sessions. And you're very right, it is so important. It is available out there, but the important thing is to educate people that it is available because people don't know. They don't realize that, hey, what, it's okay to grieve and it's okay to seek help for grieving. So it is very much available there. In the public sector, I'm not sure how much is available in these particular cases, but in the private sector, it is available. And even if it is specific to anybody that you may know, we could always chat after as well too. And I could give you some information in terms of reaching out for it.
Any further questions? If yes, we have one from Jenny.
Okay, so when we think of palliative care, we think of being assigned to a home per se. is that a service that can be extended to the person's home instead? Because, when we get older, we tend to want to be home, as we say, in a more comfort environment. I don't know if there's that facility that can be extended to the home. Just asking.
So yeah, it is available in the home setting. So for example, where I work, this is essentially what we do. We provide the palliative care at home for patients with that multidisciplinary approach. So just not just doctors, but nurses or caregivers or physiotherapists. All these things are at home. But there are other doctors who may be able to come home and provide that service as well too. So it is available. I don't know how much of it is available through the public sector. There is an aspect of the community nurses that do go out, but the public sector is also very much overwhelmed at times as well too. But there is the service available nationally here through through private organizations that provide it at home, and the full extent of it. So yeah. So if after I could always share the information with you as well to for the details.
Thank you. And as a segue into there's one more question?
Yes.
Yes.
Sitaram, everyone. I just want to ask a very simple question here because as you had clarified earlier on, because the normal person associates palliative care with hospice. But since you have broadened the definition, are there any instances where a person came out of palliative care?
So they would not be, nobody would have come out of palliative care. Their palliative care may have stretched much longer than expected, because by definition, the palliative care comes in once you have any life-limiting illness, meaning that diagnosis is a diagnosis for life. So they may have their palliative care may have stretched out. They may not have needed any aggressive intervention. They may have had to see maybe a doctor maybe once every 6 months, but they would not have ever come out of it because of their diagnosis. Their diagnosis have always put them at risk for declining, where they would have needed some support at some sister. But it's not that they would have gone into remission or rehabilitated to a point where they would not require palliative care. It's just that it may have stretched on for years. And I could be honest with you, there are cases that I've seen where we have expected that people might have declined faster than we thought, and they've held on, and they have not just held on a bed, they've held on and they have rehabilitated, and their quality of life has improved significantly. But they have not come out of it because the diagnosis that made them a palliative patient in the first place is a life-limiting illness. It is a long-term condition.
Thank you. And I think that brings an end to our questions, but I'm sure Doctor will facilitate further questions at the end if that's possible. And we want to present a token of our appreciation at this time. And we have a young member of the Mandir, Keaton, who is coming forward to present Dr. Kotiwala with a wonderful, a small token, but big in our appreciation this morning, doctors, for your time, your effort, and your information.
Thank you for having me. Appreciate being here.
Thank you so much once more. Give him a round of applause. Wonderful. I now invite members of the congregation to come forward and to perform your arti as members of the bhajan group, the kirtan group, engages in kirtan.
चंद्र कलाधर सांब सदा शिव 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 शंभो महादेवा शंभो शिव कैलाशोकिवासी धौलीधारो ही राजा शंकर संकट हरना शंकर संकट हरना शिव कैलाशोकिवासी धौलीधारो की राजा शंकर संकट हरना शंकर संकट हरना तेरे कैलाशों का अंत न पाया
तेरी कैलाश का अंत न पाया
अंत भी अंत तेरी माया ओ बोले बाबा अंत भी अंत तेरी माया शिव कैलाशोकिवासी धौलीधारो की राजा शंकर संकट हरना शंकर संकट हरना बेल की पत्तियां बांग धतूरा
बेल की पत्तियां भांग धतूरा
शिव जी की मन को लुभाए ओ बोले बाबा शिव जी की मन को लुभाए शिव कैलाशोकिवासी धौलीधारो की राजा शंकर संकट हरना शंकर संकट हरना एका ताजिरा तेरा चंबेरे चोगाना एका ताजिरा तेरा चंबेरे चोगाना दुजा लाई तिता पर मोरा ओ बोले बाबा दुजा लाई तिता पर मोरा शिव कैलाशोकिवासी धौलीधारो की राजा शंकर संकट हरना शंकर संकट हरना शिव कैलाशोकिवासी धौलीधारो की राजा शंकर संकट हरना शंकर संकट हरना शंकर संकट हरना
नाम ले लो शिव का मीते पाप सारे नाम ले लो शिव का हाँ नाम ले लो शिव का मीते पाप सारे अजब रूपधारी शिव जी हमारे अजब रूपधारी शिव जी हमारे भेद नहीं जाने तेरे खेल न्यारी भेद नहीं जाने भेद नहीं जाने तेरे खेल न्यारी अजब रूपधारी शिव नीले नीले कंठ में सर्पों की माला है,
नीले नीले कंठ में सर्पों की माला है,
नीले नीले कंठ में ये सर्पों की माला है,
नीले नीले कंठ में सर्पों की माला है,
अंग में बबूती तन ओढ़े मृग चाला है,
अंग में बभूति तन ओढ़े मृग चाला है,
अंग में बबूती तन ओढ़े मृगशाला है,
अंग में विभूति तन ओढ़े मृगशाला है,
शिव जी जटाओं में, हाँ शिव जी जटाओं में गंगा पधारे, अजब रूप धारी शिव जी हमारे, अजब रूप धारी शिव जी हमारे। कभी कभी पहन के चले ये रुंड माला है,
कभी कभी पहन के चले ये रुंड माला है,
कभी कभी पहन के चले ये रुंड माला है,
कभी कभी पहन के चले ये रुंड माला है,
एक हाथ डमरू और दूसरे में 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 माला है,
पिए भांग निस दिन, हाँ पिए भांग निस दिन ये भोला हमार, अजब रूप धारी शिव जी हमार, हाँ अजब रूप धारी शिव जी हमारे। माथे पर चंद्रमा भी करता उजाला है,
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 बताते ये अमृत पिए विष का प्याला 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 है,
होते दर्शन की उनको, हाँ होते दर्शन की उनको मन से पुकारे, अजब रूप धारी शिव जी हमारे, अजब रूप धारी शिव जी हमारे। नाम ले लो शिव का मीठे पाप सारे, नाम ले लो शिव का, हाँ नाम ले लो शिव का मीठे पाप सारे, अजब रूप धारी शिव जी हमारे, अजब रूप धारी शिव जी हमारे। भेद नहीं जाने तेरे खेल न्यारी, भेद नहीं जाने, भेद नहीं जाने तेरे खेल न्यारी, अजब रूप धारी शिव जी हमारे, अजब रूप धारी शिव जी हमारे, अजब रूप धारी शिव जी हमारे, अजब रूप धारी शिव जी हमारे।
We'll have one more bhajan followed by our announcements.
शंकर शिवा शंकर शिवा शंभो महादेव शंकर शिवा
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 शंकर गुरु उमापति शिव शंकर गुरु
शंकर गुरु शंकर गुरु उमापति शिव शंकर गुरु
शंकर गुरु बाबा शंकर गुरु उमापति शिव शंकर गुरु
शंकर गुरु शंकर गुरु उमापति शिव शंकर गुरु
नंदी वाहन शंकर शिवा
नंदी वाहन शंकर शिवा
नंदी वाहन शंकर शिवा
नंदी वाहन शंकर शिवा
नागाभूषण शंकर शिवा
नागाभूषण
शिवा शम्भो महादेव शङ्कर शिवा
Flowers in hand, you offer prarthana, seek the blessings of Bhagwan. Om Shuklam Bharadram Devam Shashivardam Chaturbhajam Prasannam Vadadam Jayate
Check 1 2.
Siddhivinayakabhyo Namaha. Om Sajam Chavarati Samayuktam Vahinam Yoditam Maya Trailokadmiyakaram Deepam Parameshwaram Deepam Darshe. Om Ekadantaya Virmihi Vakradundaya Dhimahi Tanno Danti Prachodayat.
Sitaram devotees. Sitaram devotees. Man's waking up this morning. Dr. Kudiwala put you all to sleep. All right. So, first of all, welcome to each and every one of you to our Sunday morning service. For those of you who are here for the first time, special welcome to you. For those of you who are here after some period of absence, special welcome to you as well. In his absence, we want to say a very special thanks to Dr. Kudiwala for giving his time this morning to educate us on a very, very important topic of palliative care and palliative medicine, something that's growing in importance in this country and something that we should all be aware of. For anyone who's celebrating a birthday or anniversary this upcoming week or this past week, special happy birthday to you. Anybody celebrating their birthday or anniversary? Who's that? Ranveer? Happy birthday, Ranveer. Today, we actually have our youth leadership program, which is back again this morning, which you all see the youths here in their yellow jerseys and also in all green jerseys. The topic today is a very interesting one on cyber security. We actually have our very own Darren Dore and Amy Ramnari Babulal who is doing a cyber security escape room, something very interesting. That they will learn about cyber security and how to navigate that in this world of technology. For those of you who have any donations, whether it be in cash or kind, can see Uncle Gangadin in the back after service, as well as anyone who wishes to perform puja on a Sunday morning. We have Shravan Puja is continuing tomorrow, and will be the second Monday, and we are continuing for 4 Mondays, so two Mondays after, right here in the Mandir at 6 p.m. There's also yoga class tomorrow and every Monday at 5:30 right upstairs in the annex. So for those of you who wish to join the yoga class can do so tomorrow as well. There is Krishna Janmashtami, which is coming up on August the 15th, right here at the temple. So for those of you who can look out for that coming up and more details on that coming up as well. The 17th of August, there will be a dance concert at the temple. It is now being in the planning stages, but I'm putting you guys on alert. It will be on the 17th of August right here in the temple, so look out for more details on that coming up as well. Uncle Babulal and family is having their yajna, which is starting on Tuesday. Let's pull back up that. They should come up on the screen soon. So that's starting on Tuesday. It is in celebration of 45 years of marriage bliss. It is right here at the temple. It's 6:30 to 8:30 for 5 nights, and officiating will be Pandit Lakshmidat Prasad Maharaj and assisted by Pandit Avinash Maharaj. Dinner will be served every night, and parking will be available in the school after for that event. Stemming from our clinic last week, we actually had a couple donations that came in after the clinic of, well, I wouldn't say what it is just yet, but we did have a couple donations through our partner in the Healthy Mind Foundation. We had a donation of a few gifts, and we want to still give it out to the temple audience because it was donated for the clinic that was here last week. So I want a brave volunteer to come up and answer a quick question, because we're not going to choose who to give it to. So anyone wants to volunteer to come up and answer a quick question? Anyone at all?
So the question is on what the doctor presented during the course of today's service. So it's testing how well you listened.
It's a very simple question, very easy question. Nobody wants to give?
It's the winning lotto ticket from last night's draw.
Anybody? We try to it's based on the lecture that we did this morning. It's a very easy question.
So, Mitra, ask the question and then hands can go up and.
Oh, look at.
Yeah, Mitch.
So the question was very
Sit down,
simple
everybody.
on what is palliative care and what is on what Dr. Kodiwala spoke about this morning.
All right, so palliative care it has a common misconception where it really is. A lot of people think of it as hospice care, and palliative care really begins from what he described, from diagnosis, from probably an end stage disease, going forward and making life a little bit more comfortable for that person to ride out their disease.
Yeah. So we had a This was not nepotism. He put up his hand. All right, so we actually have it up here from Dr. Kodiwala's slide this morning as well. All right, sit down, everyone. Enjoy the rest of your week.
Thank you. We will all stand for final arti before the harmonium kicks in. As you know, Ganesh Utsav is being celebrated from the 26th of August, going straight on till the 6th of September, where we will have the Visarjan. Our Yagya commences on September 1st and runs for 5 nights. We already have families that have booked the 1st of September and the 5th of September. The 2nd, 3rd, and 4th of September, those dates are open, so give it some consideration. If you and members of your family would like to sit to perform puja for the Yagya for Ganesh Utsav, 2nd, 3rd, and 4th of September are the dates available. Please give your name to Mrs. Rama Sharma Umrao or Mrs. Renuka Maharaj so that we can book you in accordingly. I now hand over to the group for final arti.
ॐ जय जगदीश हरे स्वामी जय जगदीश हरे भक्त जनों की संकट दास जनों की संकट क्षण में दूर करे ॐ जय जगदीश हरे ध्यावे फल पावे दुख बिन से मन का स्वामी दुख बिन से मन का सुख संपत्ति घर आवे सुख संपत्ति घर आवे कष्ट मिटे तन का ओम जय जगदीश हरे मात पिता तुम मेरे चरण गहो किसकी स्वामी शरण गहो किसकी तुम बिन और न दूजा तुम बिन और न दूजा आस करो जिसकी ओम जय जगदीश हरे तुम पूरन परमात्मा तुम अंतर्यामी स्वामी तुम अंतर्यामी पार ब्रह्म परमेश्वर तुम सबके स्वामी ओम जय जगदीश हरे तुम करुणा के सागर तुम पालन करता स्वामी तुम पालन करता हम सेवक तुम स्वामी हम सेवक तुम स्वामी कृपा करो भरता ओम जय जगदीश हरे तुम हो वेद अगोचर सबके प्राणपति स्वामी सब
की सेवा ओम जय जगदीश हरि तन मन धन सब है तेरा स्वामी सब कुछ है तेरा तेरा तुझको अर्पण तेरा तुझको अर्पण क्या लागे मेरा ओम जय जगदीश हरि ओम जय जगदीश हरि स्वामी जय जगदीश हरि भक्त जलों के संकट दास जलों के संकट जन में दूर करे ओम जय जगदीश हरि ओम जय जगदीश हरि ओम जय जगदीश हरि
Hari Om. As we conclude our puja and our satsang this morning, we do so with a sense of gratitude for all of the blessings that we've been bestowed with. This gift of life, this human body, our faculties and our ability to worship Bhagwan, to offer our love to Him in a very deliberate and focused way. We pray this morning not only for ourselves and our families, but we pray for all those persons who may be ill, those persons who may be ailing in some way. We ask you, Prabhu, to restore them to good health once more. For those individuals who may have lost their loved ones, we ask you to provide them with that strength and with that solace to overcome their loss and their grief. And for those individuals who are bent on criminal actions and deviant behavior, we ask you to influence their minds and their thoughts so that they will move away from that pathway and to one which is closer to you. For you are mother and father, you are family, you are friend, you are knowledge, you are wealth, you are everything to us. We surrender ourselves completely to you. Hari Om. Tvameva Mata Cha Pita Tvameva Tvameva Bandhu Cha Sekha Tvameva Tvameva Vidya Dravinam Tvameva Tvameva Sarvam Mama Deva Deva Om Asato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityurma Amritam Gamaya Om Shanti 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 Hari Om. प्रेम से बोले श्री गणेश भगवान की जय, मापति महादेव की जय, वृंदावन बिहारी लाल की जय, आज शक्ति जगदम्बा देवी मैया की जय, श्री पवन पुत्र हनुमान की जय, प्रेम से बोले श्री सच्चे सनातन धर्म की जय. To those around you, सब कोई जय जय सीताराम. I see the sun has arisen. There's so many t-shirts here in yellow for the youth leadership program. We just need to see the t-shirts here at 8:30 in the morning. Sitaram everyone. Enjoy the rest of your day and week ahead. May you have a powerful and productive week. Sab koi.